couldn't be a more exciting time to be a clinician, to be a clinical investigator in the area of gynecologic malignancies, both from the perspective of, we're still learning about anti-angiogenic agents. The PARPs, we have 3 PARPs approved now as maintenance therapy in ovarian cancer. The yet to be proven, but I'm certain will be proven, role of checkpoint inhibitors in subsets of patients. Ovarian cancer, maybe cervix cancer, endometrial cancer, and of course the giant in the room, the paradigm-changing concept of precision cancer medicine, which in fact this ASCO meeting, Dr. Bruce Johnson has dedicated to that approach. He, in particular, has had an enormous role in the development of precision cancer medicine in lung cancer, and this absolutely carries over to gynecologic malignancies. The idea of molecularly testing, DNA testing today, but in the future it'll certainly be more than that, to try to define the particular abnormalities that are driving a tumor and developing drugs and drug strategies to that, including in immunotherapy. That is the future. It is the current and is absolutely the future, and I'm extremely excited where we are today. Much more important where we're going to be tomorrow and the day after that.